My name is Mohini Alanis, and I'm a nurse practitioner here at Brain and Spine Neurosurgical Institute. I'd like to talk to you today about occipital headaches or occipital neuralgia. Occipital headaches are headaches that specifically affect the back of your head. There are nerves that originate from the top of your neck and come over the top of your head that lie very close to the skin. These nerves can become easily inflamed, especially if you have a pinched nerve secondary to muscle tightness or degenerative disc disease or arthritis. You can also experience inflammation of these nerves after an injury to your neck or your head. The symptoms of occipital neuralgia include piercing or throbbing pain. It's sometimes described as burning, and it typically originates at the base of the skull and radiates up over your head and at times even into your eye on the affected side. It usually just affects one side at a time, but it can affect both sides. The diagnosis of occipital neuralgia is somewhat tricky to make. There is no definitive test that can tell you if you have occipital neuralgia. A visit to your provider to give a detailed history as well as have a physical exam is critical in beginning to make a diagnosis of occipital neuralgia. Imaging may be ordered, such as an MRI, an X-ray, or a CAT scan, and this can also assist us in making a diagnosis. Treatment options for occipital neuralgia include physical therapy or massage therapy to loosen the muscles in your neck. You could always try medications such as over-the-counter anti-inflammatories, Tylenol, or topical ointments or rubs. Finally, we can do what's called an occipital nerve block. This is when a small amount of medication is injected into the base of your skull into the skin. That medication is a combination of a numbing medicine as well as a steroid, which is a very potent anti-inflammatory. Some people report relief from their symptoms within a day or two, but don't be discouraged if you don't feel better right away. I would always recommend that you give it a full 2 to 3 weeks before you decide if it has helped you or not. You can safely have up to 3 injections every 6 months to manage your symptoms. It's also important to identify triggers that may be causing your headaches, such as repeated exercises, prolonged forward flexion of your neck, or even strenuous activity. Hopefully this has helped you in understanding occipital neuralgia, and if you'd like to call us anytime to ask questions, we'd be happy to talk to you. Also, you can check our YouTube channel, Spine Together, for more informational videos. Thank you very much.